Today's webinar is all about transitioning into survivorship. We chose this topic because it's National Cancer Survivors Month, and we want patients to feel confident in transitioning to the next phase after treatment and to make sure you all have the resources and support you need during this time. We are very excited to have Dr. Perez share her expertise on this topic with us today. Dr. Giselle Perez is an assistant professor of psychology at Harvard Medical School and the director of the Mind Body Program for Cancer Survivors at Massachusetts General Hospital. And with that, I will turn it over to Dr. Perez for her presentation.
Thanks so much, Hannah, for the warm welcome. And I'm going to go ahead and share my screen right now and hope that it works. And so are you seeing desktop? Are you seeing presentation?
We can see your slides. That's perfect.
Okay. And not desktop or presenter's view. Perfect. All right. So thank you all for having me here today. I had mentioned actually to Hannah earlier on, I do a lot of my work with lymphoma survivors, individuals impacted by lymphoma. And so I feel privileged any opportunity that I have to come speak to individuals directly, because I know based on my clinical work and my research work, that this is especially the post-treatment period is a challenging time for many patients and their families. So I want to start out by discussing why this is important. And, in terms of methodology, I'm a qualitative analyst, and I really believe in the power of words and stories to convey a message. For that reason, what you'll see right now in the presentation is an example quote from one of our lymphoma survivors who participated in one of my trials, who described what the challenges were like following the completion of their treatment. In summary, okay, I have cancer today, and then suddenly you come home and you're done, right? So let's start with the good news. What we have seen is tremendous advances in the care of individuals who have been treated for cancer and lymphoma, and these have led to an increase in the number of cancer survivors. These data are a little bit outdated at this point, but as of 2019, so several years ago, we saw about 16.9 million survivors were living in the US, and we expect that number to increase to about 22.2 million by the year 2030. And so over the next decade, we also expect that number to continue to grow in terms of individuals who have lived 5 or more years after their cancer diagnosis. All right. And so what has been happening because of this steady increase in improvements in cancer therapies is that there's been a shift in focus on our attention to finding ways to really help support patients when the needs emerge after treatment ends, right? Because a lot of the focus to date has been on how do we help survivors or how do we help patients while they're going through cancer care. But as we're seeing them live longer and longer over time, we're trying to figure out how can we actually improve their overall well-being, their overall quality of life. And this end of treatment period, and that's really the focus of our talk today, has actually been identified as being sort of a really critical phase in the continuum of cancer survivorship. And over the past several years, it has been identified as a critical phase. Think about what happens at the end of active treatment. And especially think about what happens as an individual who's gone through lymphoma. What we find is that lymphoma survivors face a often prolonged recovery period that's marked by persistent symptoms, things like continued pain or continued fatigue. Then there's the indescribable emotional challenges that emerge. So there's the experience of uncertainty and having to sort of having this fear of what the future brings, along with fear of recurrence and having difficulty describing that fear to loved ones. And the issue is, and what I find with my patients is that these challenges come with very little preparation. They're often very much unexpected. And for this reason, patients report feeling them and not really talking about them. And so that has led to increased impairments in their overall functioning, their sort of transition, and their overall quality of life. And so one vivid image that one of my patients in the past has drawn is this experience as if you're participating in this high speed chase, and then suddenly everything stops and you're dropped off on the side of a highway and everything keeps moving forward while you're left behind. And so this is what really leaves people struggling with this adjustment period, this feeling like they're left behind and no one's there to understand. And so patients report feeling this sense of abandonment, not only by their support network, where there's a constant shift in that, but also by their medical team, especially as visits start to become less and less frequent. And what happens is people do have this urgency to return to what life is like after treatment. So the same familial roles, the same job roles. But the issue is that now those things they look different, they feel different. There's difficulty focusing sometimes that happens, or even caring for the job that you used to be so invested in, or feeling suddenly ineffective in your role as a parent or as a spouse. You might have body image concerns, changes in sexual functioning, interest. Things can get in the way of romantic relationships. There could be greater chasms that are created. And then, as I mentioned, there's the consistent treatment related side effects that, again, were not things that you anticipated to be a continued concern after treatment ends. Things like word finding challenges, feelings of neuropathy, random bouts of fatigue or continued fatigue. And so, this just highlights broadly some of the kind of rates and prevalence of kind of distress or distressing patterns that we find our patients, where 15 to 40%, if not more, report having needs and having those needs be unmet. Nearly all patients experience some level of fear of recurrence, and that level can vary, again, often by diagnosis, but not necessarily so. And so levels can rise as many as 30 to 70% of survivors. Having follow-up visits, having symptoms that resemble when you were initially diagnosed, being a person or it could be a public figure that's suddenly diagnosed with cancer, all of these factors can trigger that fear of recurrence. There's financial burden as well, which again is a topic that not many people talk about. And so importantly, and I'm going to describe why this is important to highlight, but it's cancer is the obstacle, treatment is the obstacle, right? But it's more than that, right? It's everything else. And you don't have to go very far to understand what I mean by how everything else impacts how you're feeling and the post-treatment experience. Everything with regards to what's happening in your environment, economically, politically, socially, all of those things are looked differently. They're looked at through the cancer experience. Things that maybe mattered before don't matter in the same way. For instance, when things like COVID-19 happened several years ago, that itself triggered worry for patients about cancer recurrence. And it also resembled this, it sort of was a reminder of like how life goes on and also is put on pause. And suddenly everything, all the milestones that you were looking forward to are no longer possible. And so this is what my survivors, my patients are telling us. It's, again, this idea that it's cancer and it's not, right? It's everything else. And so when it comes to what their needs might be, there's a lack of focus on everything else because so much emphasis has been on treating the diagnosis, and that's it. And so that's where I come in, right? What do we do with this information? How do we help individuals who've gone through treatment manage the challenges that begin once active treatment ends? And so many have turned to mind-body medicine, myself included, as a clinician, as a psychologist, to really think of it as a way to help individuals who've gone through cancer manage the many challenges that arise after cancer treatment. The field of mind-body medicine is based on this understanding, this common understanding that how we feel, how we think about things, our behaviors, our physiology, all of these things are so interrelated. And so our thoughts, emotions, and behaviors have a profound impact on our body and vice versa. And for that reason, mind-body medicine uses a variety of tools and approaches to help our mind influence our body and our body's functioning. But before I continue, I'm hoping to play a clip that often represents how people feel when I mention things like mind-body medicine. So let's see if this, Hannah, if you can't hear it, let me know.
I cannot hear it.
Okay. All right. So we'll skip it then because oftentimes the audio doesn't always fully translate. But just to let you know, so again, I'm a big on storytelling, and this clip basically has this issue where the individuals in this sitcom are, doing all this work, dishwashing work, and it's gruesome. They don't want to do it, but then one of their friends is like, well, maybe we just practice mindfulness and we just sit with it and sort of let our thoughts be, right? And then they try that practice, and then suddenly somebody says, oh, we can do this other thing. And then everybody leaves. But ultimately, it's because nobody wants to do it. Nobody wants to do it. Nobody wants to do it because they think, gosh, how does it actually work? And I can't sit with my thoughts, right? So ultimately, it's this general lack of clarity. There's a general lack of clarity about what mind body medicine is. There's frustration when people try it and it doesn't work, just like the video clip that you couldn't see. And when it doesn't work, people say, well, it's not for me. And I'm hoping that after today, you will understand how it can actually help you in supporting your transition. With mind body, there's this term resilience, and I do a lot of resilience work. Resilience refers to this ability to bounce back while in the midst of some challenging life situation. Mind body medicine is linked to this idea of resilience in that it provides people with tools to enhance their body's natural ability to cope with stress and adversity. And that is what we think is central to maintaining resilience, right? And so, like I said, people struggle with these concepts for many reasons. And in order to help you understand how this connects with you, I'm going to start by talking about stress. All right. And we'll talk just simply about stress. So let's start with that. What do I mean by stress? If you were to ask a stress researcher, they would define it as a non-specific response of the body to a demand. Your stress is a demand, right? This thing that happens, and your body tries to respond to that demand. This demand can be big or small. It could be major life events, such as a diagnosis, like having cancer, or it could be a bunch of like small things, daily hassles, like getting stuck in traffic or having, being late to work or to an important meeting. They could also be good things like going on vacation. And for that reason, when we think about stressors by definition or stress, that response, it's completely normal and actually appropriate to experience stress. And when stress becomes a problem, though, depends on our perception, right? So Lazar and Folksman's model of stress and coping describes that kind of interaction. This model says that if you perceive yourself to have lots of things, lots of demands, but you perceive yourself to have the resources to manage those demands, then the amount of response, that perceived stress, is low. It's small. You might actually consider that to be positive stress, the stress that helps you move and get things done. However, if you perceive yourself to have lots of things to do, lots of demands, lots of challenges, and you counter to that, feel like you don't have enough resources or enough ability to manage all of those demands, what you see or what you feel is high levels of stress. And so what corresponds to that is distress, that negative emotional reaction to that imbalance, right? So what happens when we feel stress, right? When we have that perception of there's a lot and I can't do it, I can't handle it, what happens is our body tries to keep us safe, right? There's a set of physiological changes, and we've called this the stress response, right? That happen in order to keep your body safe. Think about what happens when you have to protect your body from something that's really dangerous. I often make the joke, a lion, a tiger, a bear, oh my. If you were encountering something dangerous, truly dangerous environmentally, right? You need your big muscles to function. Like you need your legs and your back, and those function to keep you upright and moving. You don't, however, need to digest food because that's actually a misuse of resources, right? You're directing resources to something that's not going to help you fight danger, right? So that's why in response to danger, a lion, a tiger, or a bear, your body activates its alarm system. That alarm system is the sympathetic nervous system. And what this system does is it moves resources to the parts of the body you need to respond to danger, and it moves resources away from the non-essential places. What that feels like, though, is cold fingers, pounding heart, headache, dizziness, breathlessness, and indigestion. You may notice you start to sweat, or you're maybe at the point of having a panic attack. But remember, this is your body's way of trying to protect you. However, it doesn't feel good. And many of these actually mimic a lot of the maybe initial symptoms that you experienced before your diagnosis. Our body tries to help us. So the danger, once our body or our minds realize the danger is gone, it says, hey, things are fine, go back to normal. So you don't stay with your heart racing. You don't stay sweating, right? You suddenly kind of regain control. But you might ask yourself, why is the stress response a problem then if it fixes itself? Well, it's not a problem if you're truly being attacked by something dangerous. However, it's a problem if it gets triggered daily, right? Maybe you're going grocery shopping, you're stuck in traffic. Maybe you've got a lot of things to do at work or at home. Maybe you're thinking about all the things that have changed since you've gone through cancer treatment, right? So everything, negative thoughts, emotions, your worries, your sad mood, all of those things trigger the stress response much in the same way as a lion or a tiger or bear. Your body reacts in the same fashion, right? Redirecting resources to the parts that they think is needed to fight danger and away from the parts that you don't need. Have you ever noticed that you have indigestion, for instance, when you're feeling stress, right? That's your body helping you. And the important part here is that our body can't distinguish between real and fake danger. So if you're constantly thinking about, let's say, recurrence, you're creating, because of that connection between our mind and our body, that physiological sensation that heightens that and keeps you in that stress response, right? And so what happens over time is your body turns on and off that stress response, right? Because it's constantly trying to help you and adjust. What happens is that on and off action wears down your body, right? And like a battery, it breaks down. And that's what we hypothesize leaves you at high risk for, illness or worsening of illness, right? You might have noticed this be the case when you return from vacation and, you're kind of active and doing things, but then suddenly when everything's back, kind of calmed down, that's when you're actually sick. That's because you were in a chronic stress state, because good stress can be good and bad. Or if you were in the midst of a work deadline, same thing happens. Once the deadline's gone and you're kind of back to normal, that's when actually your body catches up. And that's when you might find that you have a cold. So I'm not going to go through this very much too closely, but this idea that that's the connection that we think helps or is connected between stress, right, the demands, and our health, right? When there are mood changes and also behavioral, there are things that we do, right? Maladaptive, what we call maladaptive coping. Maybe when people are stressed, they might not exercise, they may not eat well, they might use substances. So there's so many other factors that through our behaviors can impact our health. This slide is also important. I often share with my patients is there's a difference in how you're thinking about things, right? When you're in the stress response, the part of the brain that's activated is the amygdala, the emotional center of your brain. What that means is that you are going to respond before thinking, right? You have muddied thinking. So what I often do is describe this as when you're in the stress response, that glass and that mud in there, right? That mud is exemplifying your thoughts. When you're in the stress response, you're not going to see clearly because your mind is racing, right? And so if there's enough mud there and you're stirring that glass of water fast enough, there is no thinking clearly, right? That's different from when you're in the relaxation response. That same glass that has mud, again, it's supposed to exemplify your thoughts. If you settle that glass with water and mud, the mud falls down to the bottom, right? And then you can see through that glass. So that's an important piece for when people say, I can't remember stuff. Well, that's often because we are in a chronically stressed state. And you might experience this at home. You misplace your keys, but once you stop paying attention to that, you'll find your keys, right? You're thinking much more clearly. So again, how is this relevant to me? Well, a cancer diagnosis is disruptive for the many reasons that I've described to you. All of the challenges that you're describing, all of the thoughts that you've felt, all of those trigger that stress response much in the same way as I've described, as if you're fighting something that's physically endangering you. And that's what brings us back to mind-body medicine. All right. Numerous and numerous studies have started to show that mind-body medicine is often the most effective way to reduce symptoms and to treat and prevent stress, right? And it's because mind-body medicine understands that interconnectedness of our emotions, thoughts, physiology, and behavior, right? And so what mind-body tools do is that they teach us how to regulate each of these components so that they become more balanced and therefore are able to better adjust in the midst of chronic life stress. And what they do is, as I mentioned, they work by deactivating that stress response, deactivating the sympathetic nervous system by upregulating that rest and relax part of our nervous system. And what it feels like, it's so looking more like this when you're stressed, instead of looking like this, right? Looking more like this, relaxed image and not so out of sorts. There are so many different types of mind-body techniques, right? But the connection here is that they take a wellness approach. This differs from modern medicine, right? Modern medicine right now says, let's wait until there's a problem and then let's treat it. And that's often the case when it comes to distress that my patients feel, right? The stress after going through lymphoma treatment is significant. But people don't talk about it. Not only do people not talk about it, many don't ask, right? And so people are suffering with those challenges on their own. And only after that distress grows with time do I see the patient, right? That's when I often get the referrals, when it's already gone to a point of being clinical levels of stress, maybe depression, maybe anxiety. Mind-body medicine says, hold up, life is stressful, right? So let's promote health. Let's promote wellness. Let's prevent anything from sort of declining with the understanding that we can give you tools to help balance your emotional state. All right. And there are a lot of different things that are considered to be mind-body medicine. And I will talk to you a bit about how actually you can think about it differently to make it useful for you, with the understanding that most people don't like to think of it as, meditation or, Tai Chi. They just don't want to practice that. And that's okay. You don't have to. But the idea is that we're going to use mind-body medicine to balance yourself out. It's holistic. It takes into consideration the whole person, not just a part of the person, right? And so it targets your brain. It targets your body. It targets your emotions. It targets your behavior in efforts to promote well-being. For the sake of time, I'm not going to go through an example practice today, although I'd be happy to go through a lemon imagery exercise, which is my favorite to do with people, because that's when they're like, oh my gosh, I can't believe how quickly our bodies and the physiological processes are connected. But what I will teach you, or one of the first tenets of mind-body practices or relaxation response practices, is eliciting that relaxation response, right? You hear about meditation, you hear about deep breathing, mindfulness, right? All of those things are what people think about when it comes to mind-body. But the problem is that most people don't understand what that actually means, right? They think, as I mentioned when we first started talking, that it is simply shutting your thoughts. Let me tell you, it's really hard to stop thinking. And that's okay, right? When we think about the relaxation response, I'm not telling you to stop thinking. That's not realistic. That's not possible. That's too hard to do, right? So when I'm asking you to elicit the relaxation response, I'm asking you to pick an anchor, right? Pick an anchor, something that's strong, that works. This anchor could be your breath. It could be counting. It could be an image, it could be a song, it could be so many different things. But the idea is that this anchor has to be something that's strong and that you can do in a repetitive way. Why? Because your mind, your thoughts will wander. And I ask you to expect that to happen. All right. But every time your mind wanders, this anchor brings you back to center. And that process of mind wanders, coming back, mind wanders, coming back, that and the non judgmental awareness, right? Basically, not judging yourself because your mind is wandering, that is what helps elicit that relaxation response. And so that's why I mean, you don't have to do meditation. You don't have to focus on deep breathing. You can find what works for you. When I've worked with people, sometimes the first thing I ask them is, what do you like to do? What do you like to do? I've had people say, I love ice skating. And we talk about how we can use that, or swimming or running, to elicit the relaxation response, right? And to get that deactivation of the stress response that I talked to you about earlier. If you find yourself struggling with picking anything that you're going to do for a long time, because most people say, well, I'm going to do 10 minutes of this. I say, okay, let's not do 10 minutes because that's hard. I want you to choose something that works for you. So we talk about, and this is based on a program that I lead at Mass General, the Smart 3RP, we teach minis. These are what they sound like: brief ways to counter stress throughout the day. You can do many throughout the day, right? They can be a single breath, it could be a stretch, it could be a sound. They can last just as, one or two breaths. They're very brief. But the idea is if you use them often, over time, they have a buildup effect, right? Much like exercise. The guidelines out there don't indicate that you have to do X minutes of exercise consecutively. You can do it and break it up in chunks and it still has benefits for you. That's the same idea with minis. And so there are different types of minis. Like I said, you can breathe a couple times, you can stretch, you can count to 4 and count back down to 1. You could do an experiential mini, which is just envisioning that you have a crayon, let's say, and a piece of paper, and you're drawing a box, and that's simply it. You can use imagery. I love imagery. I love stories. I actually do this with my kids, or I used to do this often, but it's essentially using words or images to create an image, right? Words, music, everything. I like guided imagery because that is actually a strong anchor for me. You can listen to a story. Anybody can listen to a story. And so I often say, find a story that works for you. I love the heat. I love the beach. And so when I'm looking for a guided imagery exercise, I might go onto YouTube and Google beach imagery, 5 minutes, right? Because maybe I only want to do 5 minutes. But remember, what it does is it's anchoring your mind to the story so that every time your mind wanders, you just notice and say, hey, there you are. I'm bringing you back to the story, right? That is the process. What else helps? Well, understanding and managing your thoughts, right? And this is a hard thing to do and something that I work with in my practice with my patients. But it's understanding that when we're in a stress response, our thinking tends to be, again, highly, it has a pattern of being often very black or white, catastrophic or fortune telling. Sometimes there's a blending of the two, right? So for instance, going through lymphoma, there is again, often with certain subtypes, a very high risk of recurrence. But hyper focusing, right, on that is not a helpful thought. Rather, it actually keeps you in a state of alert, right? It keeps those symptoms going. And so, what we do with certain thoughts is balancing them out, validating some of the worries that you have, but then also understanding and trying to promote those other things related to things like empowerment, focusing on what you're able to control in the moment, right? And so sometimes thought challenging exercises, some of like what I've described, well, that is a little bit different from CBT, which I do in my groups, are things that can be helpful to individuals who are going through the transition process. Managing fatigue, I found that my patients struggle a lot with fatigue. Actually, it's pretty big in my in my patients who've gone through lymphoma treatment. And so understanding the difference between sleepiness and fatigue is important. Understanding how fatigue actually creates this or can trigger the stress response. And then understanding, what fatigue looks like for you, right? What it looks like for you and what might be different levels that allow for different levels of functioning. Meaning, your fatigue, is it something that's constant? Are there high fatigue days? Are there low fatigue days, right? On the high fatigue days, what are things that you're able to do that help you feel like you're completing a task? And are there ways that you can break up those tasks to make them more meaningful and doable, right? Because one of the things that we've understood with fatigue, that it's not so much the experience of fatigue that's impairing, but rather that's distressing. What often is most distressing is the degree to which fatigue interferes with your ability to do the things you want to do, right? And so what we work on is trying to understand our fatigue better so that we can better incorporate and proceed with tasks that we want to do, so that it is so less things are, less life activities are impacted by the fatigue. So this is sort of one chart that I might do with some of my patients, which is identifying can you do on a low energy day? What can you do on a high energy day? And what activities actually help improve your fatigue? Understanding that mood and fatigue are also very much related. Humor is another wonderful coping strategy. Understanding how to use humor effectively is critical, and understanding with that the difference between the use of sarcasm and humor, right? People often use sarcasm without having a full understanding that sarcasm actually is an expression of negative emotions, which is counter to what humor is really trying to do or accomplish. Understanding your social support network and using it effectively is another tool that I really recommend my patients think through carefully. As I mentioned to you, social support changes drastically throughout treatment, right? So there's a first shift that happens with individuals with their social support network. That's when you learn who can really manage, deal with, cope with your diagnosis and who can't, right? So there's a shift that happens during treatment. But again, many people are not prepared for the shift that happens after treatment, right? And so part of what happens after treatment is, again, there are people who are not ready to hear about the continued distress that you might be experiencing. And so therefore they're dismissive. That makes us feel invalidated. And so part of the social support network is understanding who can give you what kind of support, right? So who is in your surrounding network, right? Who gives you support? Who takes support from you, right? And what kind of support do they offer? Do you have people who you can go to when you just want to emote, right? When you just want to say, this is hard. Do you have people who you can go to when you just want information, right? Do you have a place where you feel like you belong, that you're working towards a greater good or something, a common goal, right? All of these things are important and are part of our network. And so when you find that there's a gap, what I encourage you to do is to think about what is that gap and who can fulfill it, because the same person might not be the person you want to turn to for all of the different types of support that exist. All right. We talked about acceptance skills, right? So again, part of the acceptance-based coping strategies is using the mindfulness, using the breathing, using the meditation, going on the run, going on the swim, right? But the thing, and we talked a little bit about thought restructuring, but the thing that I haven't talked enough about is how you talk to yourself, right? When you're stressed, notice how you talk to yourself. How do you talk to yourself? Are you talking to yourself with kindness? Are you talking to yourself the way you would talk to a friend? What would you tell a friend who is experiencing the same kinds of things that you're experiencing, right? Because oftentimes, if you actually start listening to your inner monologue, you might notice that you're putting yourself down, right? You're expecting yourself to behave in a way that most people would say, that's really harsh, right? So can you learn to talk to yourself in a way that you would if you were talking to a friend who was going through the same thing that you were going through, right? And think back to that social support diagram. Are there others who offer you that same compassion? In other words, are able to offer you a sense of support, right? Emotional support in particular. And can you reach out to them when you're feeling the way you're feeling? No, you're not alone. Again, I started off this discussion and we're almost done because I want to make sure we have time for questions. But I started this off by saying, you're not alone, right? People don't talk about these experiences enough at all. Even to this day, despite an increasing number of studies that say the post-treatment period is often, sometimes even the hardest, right? So I want to say here and here on, everything you're experiencing is normal. It is absolutely normal. It is not pathological, right? It can become significant if left unaddressed, right? But it is absolutely normal at this time. And there are so many others that are grappling with the same concerns, but nobody's talking about it because there's a sense of protection. You want to protect your family. You also don't want to seem ungrateful to your doctors. And you're also wondering, am I feeling the way I should be feeling, right? There's a sense of guilt. But it's okay to talk about it. Providers don't ask, not because they don't care. They care very much, but sometimes it's this, it's turning to what needs to happen now and also kind of going by your cues. If you say nothing's going on, well, they're going to take your word for it. Nothing's going on. And so understand that it is normal to not to experience sometimes a sense of loss and distress after treatment ends. Your body, you went through so many things. And so it is normal that it only starts to hit you now after everything stops. And know your resources. There are a number of resources for financial concerns, for instance, depending on, their different age groups have different things, but Triage Cancer helps a lot with health insurance, where there's a lot of concerns about health insurance. There's things like the SAM Fund, which has helped for college scholarships. People who have fertility concerns can look at Livestrong, and there are some kind of guidance there. Social concerns, you have things like the organization that's here today, as well as Stupid Cancer or the Young Survivors Coalition. So there are a lot of different resources out there when it comes to your specific needs. So just look for them and understand that it's okay, because that's going to help you in that adjustment and overall quality of life. So very quickly, what's the evidence? As I said, I work a lot with survivors clinically as a psychologist in my practice, both doing individual work and group work. And then also I'm as a scientist. I have a couple of trials that I've conducted to date, specifically focused on lymphoma survivors. This is an example of one small trial that I did where I kind of grouped together a bunch of these skills as part of a group program that was delivered virtually. And what we found is that before and after delivery of this program, people's coping overall improved, their anxiety and depression went down, and their ability to tolerate uncertainty, which is huge in lymphoma, also improved. And so this was with a small trial, and actually, therefore, I have 2 more trials that will be starting hopefully this summer that is looking to do the same thing, is basically teach proactively these skills in a group setting, so that offers some validation and support. And then to see for one of the trials, does it improve coping? And for a second trial, does it actually lead to improvements in quality of life? I saw similar things with another NCI-funded trial in adolescent young adults, individuals who were diagnosed with cancer between 15 and 39. And we saw same pattern of improvement in coping, in decreases in anxiety and worry, and so on. When it looks at just generally mind-body practices as a whole, if you look at the literature, you can see how it helps patients throughout, with improvements in treatment side effects, in addressing sleep concerns, in basically improving health behaviors, and so on. And so this is just kind of a summary of all those different things that we have seen improve in patients with different types of mind-body interventions. And so with that, I invite you to fully and non-judgmentally immerse yourself in the experiences you want to enjoy more fully, and to really shift to this idea of how do I improve my well-being holistically, understanding that life is challenging, especially life after cancer is particularly challenging. So thank you so much.
Thank you so much for that wonderful presentation, Dr. Perez. So it's now time for the discussion part of today's webinar. So if you have any questions about today's topic for Dr. Perez, now is your chance to ask. And as a reminder, you can ask a question or make a comment by using the chat icon on Zoom, or you can drop your questions in the chat on YouTube, and we will be sure to get to those as well. And the first question we have is, how can I explain to friends or family that just because I'm done with treatment doesn't mean I feel back to normal?
That's one of the biggest questions I often get. And I think, you could take several approaches, right? You can determine why you want to share that, right? Because oftentimes people feel obligated to share it. You're not obligated. Sometimes they just want to share their experiences, right? And so what I recommend is writing down first and foremost what it is that you want to say, right? And why it is you want to say that. And then using that as a tool to engage them in conversation and simply say, things have changed for me. I appreciate the support you've offered me throughout this time. I'm surprised, but this after treatment period is actually a lot harder. And I don't know why. I'm trying to figure that out right now. But please understand that the best way you can support me is by doing fill in the blank, right? Meaning you can invite your ask at that point if it is something that you just want to ask in terms of their support, or you can simply just leave it as this is a struggle for me right now, and I just want you to understand. And understand that by conveying how you're feeling, right, their response might not be what you're looking for, depending on who's on the receiving end. Family often can understand, and close friends can. But understand that if people don't respond in the way that you want or need, their response is not you, right? It's not your fault. It's not anything that you're doing. It's not that you should be feeling a certain different way. Oftentimes their response is related to their own internal struggle or their own challenges with having to deal with the cancer experience here moving forward. So that's what I would say is first write down what you want to, think first, who do you want to tell? Why do you want to tell them? And then write down exactly what it is that you want to communicate to them. And understand that once you communicate that, their response may not necessarily be aligned, or it might be. But the more that you can give them indication of how they can support you, the better, because most people want to help you. They just don't know how.
Absolutely. Thank you for that. That's wonderful advice. And then our next question is, what advice do you have for someone who's trying to support patients in survivorship with phone conversations being the primary means of communication? Do you have any specific talking points?
Oh gosh, that's a great. So specific talking points. It would vary, right? It varies by the nature of the relationship. Um, I would say, first and foremost, don't assume you know what they need, right? Sometimes people don't want to talk about it at all. They just don't. Sometimes they have a specific ask, and they just don't want to ask you because they feel like they're a burden. And so the best approach I would take here is to indicate what you want to do. So starting with, I want to be a support to you, but I recognize that your needs might be different from what I think. So, if there's anything that I can be of support to you, just let me know. Right. Putting it on them, because sometimes people just want to be able to, you know, essentially emote. People want to just say things are hard right now, but they don't want to be a Debbie Downer. They don't want to be, again, seem ungrateful. And so giving them permission to feel how they want is probably the best thing that you can do.
Perfect. Thank you for that response. Um, And then our next question is, I saw that you have worked with underserved and minority groups a lot. What are some challenges that lymphoma patients face during this post-treatment transition, especially within these communities?
Such a great question. Yes, thank you. Access to care is the biggest challenge that I would say, because a lot of the challenges are similar, right? Regardless of background, and certainly even greater depending on the population, right? Is it that they have insurance issues, right? And they can't access the care at their local hospital because they don't have, maybe they live like what's happened here, for instance, at Mass General. A lot of our patients are in New Hampshire, right? And they come to Mass General for their oncology care. But for them to get mental health care, it's not possible because they're in New Hampshire and I'm a clinician who's licensed here. And so accessing care might be harder for them depending on where they're located. Financial, missing work, depending on where they are in the cancer trajectory, right? That might be harder for some, right? For some people, it's okay, it's doable. For others, it might not be it's a non-starter. Family concerns, caring for families, Latino populations in particular, we see this a lot, right? Caring for families, that becomes an obstacle as well. So I have to say, in addition to experiencing greater stress that manifests itself in different ways, I would say access to care is probably the biggest concern that I find with this population, with people who are underserved in particular.
Absolutely. Thank you. And then another question is, what are some signs that I might need professional mental health support versus trying to adjust back to life on my own?
Okay, great question. Oh my gosh. So, how do I say it? I would love, my ideal would be everybody who's gone through lymphoma treatment, cancer treatment, should meet with a provider for skills. Like I said, I'm proactive in my approach. However, if for access issues, right, because sometimes it's not possible to meet with a provider, there aren't providers that, the wait list is so long in general for psychosocial care, mental health care. So I would say if you are noticing significant impairment in your life, right? If you're noticing that you're disconnected, that your mood, your worries, let's say start with worries, your anxiety is at an increased level and is persistent throughout the week, right? And it's harder to focus. It's harder to enjoy things. You're not engaging in activities that you would otherwise want to engage in, and it's happening for in a persistent fashion. If again you're sort of not wanting to connect with people, when you do things, you're not able to enjoy them in the moment, right? And again, you're withdrawing, you're isolating. If you find that your mood again is persistent and low, right? So there's the anxiety, constant worry, but then your mood being low. If you're finding yourself having frequent panic attacks, so depending on your symptoms, that's why I say notice your level of impairment, right? And how much is disrupting your life. That would be an indication for me that it would be absolutely critical for you to meet with a provider so that it does no longer continue to impair your overall well-being.
Perfect. Thank you. And then another question is, how can I find support groups or counseling services?
Another wonderful question. So again, HealthTree, I think the organization offers support groups, connection. Leukemia and Lymphoma Society, same thing. Because again, I say I do a lot of work with individuals living and having gone through lymphoma treatment. There are a lot of support groups available there as well. There's other cancer networks that have, again, broad support groups. Sometimes for their caregivers, that's another population that often is missed. And there's an interrelationship between how that individual is feeling, how their family's feeling. With respect to anything that's greater beyond that, beyond general support group, I would absolutely recommend you asking your hospital. Go to your hospital, ask for social work, and ask them for resources that are available within the hospital. Because unfortunately, a lot of things, depending on the network, tends to operate in silos, and there are things that are available, but it really requires asking. And so your hospital will have access to some resources, hopefully that are available within your kind of network, and then using these organizations like HealthTree, Leukemia Lymphoma Society, Stupid Cancer Network, all of those things could also be useful.
Thank you. And then another question is, how can I prepare for the stress I feel leading up to my annual scans?
Mm. So this is where I'm like, can I work with you all? Um, so a couple of things, understanding, and I think the first piece that I advocate for my patients is to have awareness, understanding first and foremost, the validation of there are triggers that will be really will trigger this stress response. So annually, scanxiety is very common. So what I would say in preparing for upcoming scans, what I would say is have some, first of all, validate, also kind of prepare some activities that you can look forward to for after your scan, right? So that you have something that you're looking forward to that isn't just the scan itself. I would say also having a trusted someone who a partner, friend, family member who who you know can receive the emotional, right, who can provide the emotional support, because not everybody is able to provide that. So someone who you can talk to as you need to as you're approaching the scan, and then also trying to kind of prepare that week by having activities in place, right, practicing some of the relaxation responses I briefly taught here. So mini breathing exercises, those deactivate that stress response. So what that means is if your heart is racing, you can actually slow down your heart rate simply by engaging in those exercises. So basically setting yourself up for things beforehand, engaging in activities, practicing these RRs, having a friend who can maybe go with you, and then have something to look for after. Those are all things that we often do in preparation for scans.
Absolutely. Super helpful advice. And then the last question I think we'll have time for is how do I start to rebuild my sense of self now that I'm no longer a patient, but still don't feel like myself?
Oh, goodness. This is another important conversation. And if I can summarize this in 3 minutes, one thing that I've done actually with some of my patients is that I have them fill out a sort of a column of who they think they were before cancer, right? And to actually, and you can ask yourself, who do I think? How would I describe myself? How would my friends have described me, my family before? And then write down, after you fill out that kind of column, leave that column aside and go ahead and go on to the next column, which is how would you describe yourself after cancer, right? After the experience. Make sure that both columns are inclusive of values, things that matter to you, right? Because what you might find, and this is a constant conversation I have with my patients, what you might find is that the core you has not changed, right? The core you has not changed, but rather different aspects of you. Maybe your values, your wants, your desires, those things have changed, much in the same way as they would change with big life experiences, like getting married, having children, getting your first job, right? And so once we normalize it in that way, people are able to reconcile what they feel is two separate selves and make it whole.
Absolutely. That was a perfect response. Very succinct to that question. So thank you so much for that. And thank you for those very informative and helpful answers.
Thank you. A pleasure to be here.
So as you leave the session today, we would appreciate you taking 2 to 3 minutes to fill out a brief survey about your experience during today's event. You can also suggest topics that you'd like to see in the future because we're always looking to cover what matters most to you. So we'd really appreciate your feedback. I also wanted to quickly highlight a few of our upcoming events. Next week, we have a webinar about coping with blood cancer uncertainty. On July 1st, we have a webinar about avoiding Medicare Advantage traps and Medicaid eligibility pitfalls. And then on July 2nd, we have a webinar about fighting chronic cancer. We have a lot more exciting events in the works, so stay tuned. And the link to sign up for any of these events and many others will be sent out in the follow-up email. We also have a number of upcoming in-person events. Connect to Cures allows you to connect with other patients, learn from doctors, and discover resources in your area to help you navigate your cancer. If you're interested in attending any of these events, the QR code to register is on the screen. Before we wrap up, I just want to say thank you again to Dr. Perez for that amazing presentation and a huge thank you to you all for being part of our lymphoma community. Your support means so much and we're so grateful to have you here. I've included my email on this slide, so please don't hesitate to reach out if you have any questions, and I look forward to seeing you all at another webinar soon.